When Captain Moore decided to launch a national campaign in his own back garden, raising more money and achieving more in his 100th year than perhaps any centenarian in our history, he knew instinctively which organisation he wanted to thank and support. It was, and is, the NHS. And he was right, because there are many people and groups responsible for the UK's vaccination programme, and we owe our thanks to our brilliant scientists, to Kate Bingham and the Vaccine Task Force, which has procured over 400 million doses, 7 different types of vaccine, the manufacturers, the delivery drivers, the pharmacists, the military medics, countless volunteers. But to get this life-saving medicine into the arms of the nation at the kind of speed that we're seeing, we're relying on the doctors and the nurses and all the staff of our NHS. And it's thanks to their effort, the most colossal in the history of our National Health Service, that we have today passed the milestone of 10 million vaccinations in the United Kingdom, including almost 90% of those aged 75 and over in England, and every eligible person in a care home. And with every jab and every day, we have more evidence about the effectiveness of these vaccines. New research from Oxford University suggests the protection provided by the first dose of the Oxford AstraZeneca vaccine kicks in after 3 weeks and lasts right the way through to the booster at 3 months. And research also shows that the Oxford AstraZeneca vaccine seems likely to reduce transmission to others. And even if these vaccines cannot make us invulnerable, and no vaccine has ever given 100% protection to everybody, the evidence increasingly shows that our vaccines achieve this crucial objective to reduce death and serious illness from those major strains of COVID that have been subject to research. And in the days leading up to our review point in the week of the 15th of February, we will be accumulating even more data, helped by NHS Test and Trace, so that we can begin to chart a way ahead, starting, if the data allows, with the reopening of schools on March the 8th. And I'll be setting out as much as we can about that roadmap forward on February the 22nd. And though today there are some signs of hope, the numbers of COVID patients in hospital are beginning to fall for the first time since the onset of this new wave, the level of infection is still alarmingly high. And I'm sorry to say that we've lost another 1,322 lives in the last 24 hours alone, and our hearts again go out to every family that grieves. And the wards of our NHS are under huge pressure, with more than 32,000 COVID patients still in hospital. And so tonight, let's clap together for Captain Tom at 6 p.m. And let's clap for the spirit of optimism that he stood for. But let's also clap for all those he campaigned for, our brilliant NHS staff and care workers. And let's do everything we can to carry on supporting them. Because if we stay at home, protect our NHS and save lives, then, in the words of Captain Tom, tomorrow will be a good day.